record. Yeah. So just while our participants start to filter in, we'll let them all get connected. Okay, there. Let's begin. Okay, welcome everybody. Welcome to the Gateway webinar. My name is Jay McFarlane. I'm a board member and one of the research chairs at Gateway. Very excited to be talking with you today. This is our 32nd virtual lecture, season 4, episode 7. So I've been doing this for quite a while now. Before we start, I'd like to acknowledge the land that we're on. The Gateway office, located in Goderich, stands on the traditional territories of the Anishinaabe, Haudenosaunee, and Neutral peoples, and is connected to the Dish with One Spoon Wampum, under which multiple nations agreed to care for the land and its resources by the Great Lakes in peace. We accept responsibility as treaty people to renew relationships with First Nation, Métis, and Inuit people through reconciliation, community service, and respect. Gateway is a rural health research organization, and our mission is to improve the health and well-being of rural residents through research, education, and communication. We are, to the best of our knowledge, the only rural health research center in Canada governed by a community-based volunteer board of directors. Our topic for today's lecture: artificial intelligence, healthcare, and inequality. We have an expert panel gathered here today. Our keynote, Leslie Walker, who is a PhD candidate at University in, remind me, Leslie, it's in Geneva.
It's in Vienna.
Sorry, in
yeah, exactly.
Vienna.
Geneva, but for us North Americans, it's a potato kind of thing.
Okay. All right. Well, I'll get you to introduce our panelists in just a second here, but I want to let everyone know on all our participants attending, if you would have a question for our experts, please put it in the Q&A box of Zoom, and we will try to answer those as best we can. If you're an attendee and you see a question you want answered, you can hit that like button and that filters up to the top. Let us know that that's a priority question for our attendees. A brief disclaimer: the views expressed in this lecture may not necessarily reflect Gateway's views or opinions, but we believe in providing a platform for a range of perspectives for thoughtful discussion. So with that, I'll hand it over to you, Leslie, to introduce the talk and the panelists today.
Perfect. And to be fair, Jay, you weren't set up for success because our first panelist is Geneva Neal, so he might have psyched you out. And so Geneva is originally from Goderich, Ontario. She now works at Creative Destruction Lab, which is a startup accelerator associated with U of T. And she's there as a senior data analyst. And then Stefan Salcher is joining us from the beautiful Vienna, Austria, where I go to school. And he is the CEO of Drugstore, which is a employer branding organization, and he's a serial entrepreneur. So he has quite the extensive knowledge in terms of digital tools. I'm originally from Goderich, Ontario as well. And so it's a pleasure to be here and be talking about rural health. Although when I went to Vienna, I'm primarily looking at kind of the macro policy level, looking at European AI policy versus North American AI policy, and maybe some of the strengths and weaknesses of both. Love of rural runs deep. I had said a few days ago that you can take the girl out of Huron County, but you can't take the Huron County out of the girl. And so much of my research really has strong roots in rural for that reason. So I'm going to share my screen and just pop this up. So hopefully you can see that okay. If you can't, then please, Jay, let me know. And so today we're talking about artificial intelligence, healthcare, and inequality. And I know Jay had to give that disclaimer at the beginning, but hopefully I don't talk about anything too controversial during this session, that it all remains, pretty kosher. So with this research, I'm essentially going to look at my research on that macro level, and then finish with what can I do? Because of course, there's a large policy lens about this. However, as individuals, we have to recognize that there's only so much we can do on an individual level, and this really is going to require a coordinated effort, both bottom up and top down. So hopefully we can get into some of that throughout this. And so to start with the motivation for my research, this research came about after about 7 years of management consulting, primarily with PwC, PricewaterhouseCoopers, in Toronto, where I was able to work globally on digital implementation projects with large technology companies, including Google, Microsoft, Workday, and so on. And with this, I started to notice similar themes and patterns in terms of the types of clients we had, the types of problems they had. And so that led to the creation of this research and going to Vienna to pursue it. I'll be almost done. I'm defending this month, and so hopefully that'll be a chapter closed shortly. So when we look at global inequality remains hugely significant and profoundly entrenched. And this results in negative outcomes such as social, economic, or political instability. And in an era of rapid digitization, it's more important than ever that we collectively better understand the complicated relationship, the symbiotic relationship between humans and technology. And so, although technologies such as artificial intelligence have contributed positive benefits to society, such as reduced poverty, increased food quality and distribution, and so on, the issue is they have just disproportionately benefited high resource contexts as compared to low resource contexts. And so this creates a bit of a paradox whereby contexts of relative health, wealth, and technology are the primary recipients of the benefits of these technologies, whereas lower resource contexts, which tend to be rural regions, right, the rural versus urban divide, or the developed versus developing country divide, these lower resource contexts tend to disproportionately bear the risks of these technologies in terms of greater exploitation regarding data, cobalt, or greater job loss through automation, for instance. And so, of course, inequality in itself is a highly complex topic made up of many facets. Because of the nature of Gateway and their focus on healthcare, today we'll be talking about one of the key elements of inequality, and that is healthcare. And so with health research, we see there's very well documented research regarding health inequalities. They're referred to as health disparities, health gaps, or something called the 1090 gap, whereby only 10% of global health research is devoted to conditions that account for 90% of the global disease burden, and that most diseases prevalent in low-income regions are often neglected. There's a famous study in terms of the amount spent on malaria medication versus Viagra. One is a life-saving medication, and one is a bit of a nice to have, kind of more of a developed country problem. And of course, it's significantly skewed. So that would be a bit of an example of this 1090 gap. So recently, we have seen a substantial AI proliferation into a variety of different industries, which includes healthcare. So the global market size for AI in healthcare is about 15.4 billion globally. But what's interesting is the compound annual growth rate is about 37.5%, which is truly an insane growth rate. It is really substantial. Examples of ANI in healthcare, when I talk about ANI, that's a subset of AI, artificial narrow intelligence, which is primarily the type that we're seeing in society today. But some examples of that would be virtual health assistants, robot-assisted surgery, targeted treatments, management of medical records, and so used quite significantly throughout the medical process. 5 of the top benefits associated with AI in healthcare would be more efficient healthcare processes, substantial potential cost savings, reduced patient wait times, improved accuracy of diagnosis, and better communication and coordination with patients. And we see this is not only front office, but back office as well. So it improves processes, but also improves patient health outcomes. So the sooner the quicker you receive an accurate diagnosis, typically the better chance you have of having a positive health outcome associated with that. So although this is true on a project level, when we roll this up to a macro level, we see countries that are benefiting from this more than other countries. But the problem is, because these countries that are benefiting are already in positions of relative health, wealth, and tech, they're receiving economic growth opportunities and competitive advantages when they're already in that type of favorable position. So this growing inequality becomes truly a significant threat to modern day equality. This brings me to the problem statement associated with my research. And so while these emerging technologies have contributed many benefits to society, they have disproportionately benefited high resource contexts. Conversely, many low resource contexts have thus far realized marginal benefits, if any, associated with artificial intelligence, although this technology has the potential to contribute substantially to these regions. And so essentially with my research, I look at a variety of different resource contexts to compare differences, similarities, or areas of potential synergy through this, which correspond to the different research questions. So with the research methodology, essentially because this is a highly exploratory subject matter, because it's so new, I selected a comparative case study design. And essentially this involves selecting resource contexts which are emblematic of a distinct resource paradigm. So high resource, low resource, and a bit of a dichotomous resource environment. And so with this, it also uses a compensatory data approach, which uses both quantitative and qualitative data in order to derive as robust of research conclusions as possible. So in order to select the countries, I essentially looked at a variety of different healthcare indicators. So health system indicators, economic indicators, and technology indicators in order to give us a broad and robust understanding of different healthcare contexts. And with this, 3 countries became apparent, and so those countries were selected and compared, and was followed by a systematic review of secondary research and thematic analysis and interviews and so on. Although the methodology isn't necessarily the focus of this research, that gives you a bit of an overview in terms of the breadth of data and approach used in this report. But most importantly, we want to look at the results. So with the results, there are results related to, data quality in terms of indications of replicability, external applicability, and so on. But what I want to focus on, at least in this presentation, would be what key themes were derived from this research. And so each of these key themes represents gaps in current intergovernmental policy, whereby policies or critical nuances are either absent, insufficient, inconsistently applied, misattributed, or lacking efficacy in real-world settings. And so with this, I want to take a look at, for instance, what a policy recommendation looks like now. And when we talk about intergovernmental organizations, we're talking about the United Nations, the World Health Organization, World Trade Organization, things like that. So a typical AI policy recommendation will look something like this. Usually about 40 to 80 policy recommendations, which are pretty long-winded, as you can see. And essentially the expert feedback from it was that these typically are too vague, they're cannibalistic in nature, they're toothless, meaning that there's very little consequence for not following these policy recommendations. They represent meaningless ideals, and they're typically isolated principles, which significantly limit their effectiveness. And so with this, it's important that we reflect on traditional organizational structures, both with national governments and also with intergovernmental organizations, to see, okay, in a modern context that is characterized by rapid rates of change, shared species level challenges being AI, climate change, the increasing disease, things like that, are the traditional structures of intergovernmental organizations set up to handle those in an impactful way. We see some challenges and under optimizations. And so one of the first ones we want to look at is essentially power imbalances. They're quite complex, they're multi-layered, and they're non-zero sum. But here's a quote by prominent economist and policymaker Ray Dalio, that says international relations are driven much more by raw power dynamics. That is because there are laws and standards of behavior within countries, whereas between them, raw power matters most. And laws, rules, and even mutually agreed upon treaties and organizations for arbitration, such as the League of Nations, the United Nations, and the World Trade Organizations, don't matter much. And so we see this as heavily problematic, especially in a world with increasing inequality. With increasing inequality, we see greater power imbalances. Now, one example of this is when we look at big tech. Big tech typically represents the 5 big players, so Alphabet, Amazon, Apple, Microsoft, etc. If Microsoft were a country, it would be the 10th richest country in the world. However, intergovernmental organizations primarily focus on what national governments can do to manage inequality, and these large players are all but ignored. Of course, the irony here, right, where we talk about, for instance, rural being a low resource context, but Microsoft has a larger quote unquote economy than Canada, as well as Brazil, India, many other quite large notable countries. And so when you combine the size of big tech, it represents a force that just genuinely needs to be much better engaged in conversations related to inequality. And especially as it's becoming more entrenched into healthcare and more national governments and health organizations are using the resources of big tech, kind of putting your blinders on and forgetting this large player just simply is highly problematic. And so this brings us to one of my particularly notable recommendations, and that is the need for IGOs to foster stronger partnerships to large companies, and specifically aligning recommendations and partnerships to business and financial goals in order to foster genuine engagement. The next would be to develop a coordinated approach between countries within a region to help offset the power imbalances. And we see this a pretty positive case, for instance, with the European Union, in terms of primarily their data privacy rules. When we think about power imbalances, low resource contexts definitely normally have to make difficult decisions in terms of what they prioritize. So for instance, potential economic growth at the cost of potential exploitation. But when you think about, for instance, the size of Microsoft versus a Cameroon or similar economy, that creates a very problematic imbalance between those two. One that reasonable long-term decision-making is very challenged. And so in order to help balance those power imbalances, developing a coordinated approach between countries with shared AI values is a pretty productive methods in which to go after this. In addition, this offers an opportunity for higher resource contexts, such as EU, Canada, the United States, for instance, to remove the burden of care off of lower resource context via regulatory phenomenons and natural market forces. So for instance, when a geographic region, such as the EU, passes laws and standards, essentially big technology companies are forced to comply because the EU accounts for about a third of their average revenue. So they have to comply in order to still have access to that market. But because of the global nature of their digital products, differentiation is very difficult. And so that leads to the externalizing of these benefits beyond the borders of the countries listed within these policy recommendations. And so there are tremendous opportunities for these higher resource contexts to help nudge that burden of care. Next is related to designing processes and decision-making criteria, whereby the patient is at the forefront. And this relates a lot to operational and financial efficiency. Because as we know, when resources are scarce, strategic prioritization becomes increasingly important. And we see a lot of sub-optimization in lower resource contexts, and you often get the phrase, okay, I have $1. Where do I put that dollar? There is a case to be made that this dollar can go in many places, but I only have one. Where should it go? And so this makes sure that any projects are well aligned to patient goals and outcomes in order to be as optimized as possible. And the last represents advocating from below and more of a bottom-up approach as opposed to a top-down approach. And although there's a case to be made for this in this approach in many industries, it's more prevalent in healthcare, especially in the case of communicable disease, because there's a famous quote by Rasigan Maharaj, who's a digital policy, health policy expert, that says, "People to people, not country to country." As we saw with the COVID-19 pandemic, a passport doesn't protect you. And so with increasing globalization and the microbial unification of the world through the increased movement of people, goods, and animals, we're likely to see more shared disease, which is represents more of a human issue as opposed to a national issue. And so there are opportunities for IGOs to adjust their policies based on this. So that's all wonderful and that's high level, and I think we need to be cognizant of how intergovernmental organizations need to shift in this changing modern world. But on an individual, especially an individual in a rural setting, what can I do? And the first thing I want to talk about is the idea of personalized medicine and the empowered patient. So I know we've probably all heard about digitally enabled medicine or personalized medicine, AI-enabled medicine, but it's important we could think critically about this. To a large degree, medicine has always been personalized to some degree, right? If you have a good doctor, you can walk in, say your symptoms, and they kind of co-collaborate a treatment plan for you. I mean, if you have a bad doctor, then maybe it's a bit more top-down communication, but in general, there's always been some level of personalization within medicine. However, whether AI offers true personalization will depend heavily on the systems, processes, and broader context. And without these proper broad systems, personalized medicine may be overhyped, tends to benefit corporate interests, and runs the risk of perpetuating biases in a more concealed way. So, first, in terms of the potential de-empowerment associated with personalized medicine, there's potential for de-empowerment and the reliance on tools that are cumbersome or poorly understood by the patient. This includes, for instance, sensors, like diabetes sensors or blood sugar sensors, collecting data in which patients have no access or control of the data. Additionally, this personalized medicine approach creates more work for the patient. You have to be more involved, you have to collect your own data, you have to manage your own tools, etc., which can be very difficult. Especially when we look in Canada, we're seeing increasing work required on the part of the consumer in a variety of different ways. We have generally pretty poor quality food in Canada, so that means you need to be a nutritionist expert. Our daycare system is failing, so you also need to be a babysitter. You also need to be in charge of your own health. And so before, it was possible for people to specialize in one area of society, whereas now we have to be kind of experts at everything, and that can be quite cumbersome, and it means people who are particularly short of time, such as people who are lower income, single parent homes, things like that. A lot of these problems just say, okay, I can't deal with that today, and pushing that away leaves them at risk for significant exploitation. Additionally, greater health inequalities. So personalized medicine risks exacerbating health inequalities by focusing on populations that are already well researched and characterized or in favored positions of social and racial circumstance. So for instance, those who do have access to transportation and can drive themselves to these clinics, regularly collect data on their health, etc. Men, there's much more medical data related to men than there is women in terms of most medical data comes from more of a European ethnicity as opposed to other racial ethnicities. And so if you're a person who is in a position where your demographic is not well researched or resourced, then alarm bells should be going off in terms of I'm potentially at risk. Additionally, personalized medicine offers higher financial costs. This is typically split between the patients and or their insurance company, depending on the national context. But the point is, because we're the ones who pay for our insurance, it all kind of filters down to the patient anyways. And this can lead to potentially dangerous incentive structures, for instance, cost-saving data sharing incentives where, oh, you get to use this tool for free if you just share some data with us, or high switching costs, for instance. So if you have a medical device that collects data and you say, no, it's not working for me, I want to switch, then you have to transition off of that technology. Your data is not accessible to you, and it's very difficult. So, as an individual, you can. Now, this is going to be a bit of at a high level, but within this context, I think this is kind of the 3 important takeaways I would like you to take from this presentation. So in order to minimize that harm, as an individual, you can talk about uncomfortable topics with your peers to develop strong critical thinking skills. I mean, I think, especially in places like Canada, we're not particularly strong at having difficult conversations or even strong like critical thinking communication skills. I would say as a country, it's been deprioritized in our education system and so on. And you see even just culturally talking about money or politics or things like that, isn't that common. We're a bit more of a go with the flow type of people in terms of globally. And the problem is, if we look at something like scams, there is typically a level of embarrassment associated with this. And so we either tend to deny that it happened or we sweep it under the rug. But the problem with this is it tends to benefit those already in positions of power or receiving these kind of systemic benefits from society. And so it's important that we talk to each other in an authentic manner. Talk about a time you got tricked, you got scammed, or something happened that you didn't expect. As technology is becoming more sophisticated, we have to accept that nobody is above being scammed or tricked. That was the case before. I think there was maybe some kind of notion in terms of, oh, dummy, of course the bank isn't calling. But now that wasn't true. It's easy to catch somebody off guard. Scammers are trained in order to kind of extort information or things of value. But now the technology is so sophisticated. We have AI systems that are able to replicate your daughter's voice, for instance, and say, Mom, Dad, I need help. I'm stuck. It's much more sophisticated and much easier to get caught. Even in terms of, you can pretty easily create child porn with just photos that are on your Facebook page, for instance. That's a different level than it was before. And so I know nobody wants to talk about this. It's uncomfortable. It's scary, but it's important that people know what they're doing. For instance, when they're sharing photos or doing kind of those normal everyday things, what the potential risk is. The next is to understand power imbalances and the associated motivations and incentives. And so the problem is, in North America, power imbalances tend to be quite significant. We love corporations here, and we tend to say that the choice, belongs to the consumer. If you want to eat unhealthy, that's your right. Kind of let's remove some of the government involvement. However, that system really only works if there's relative transparency and a moderate power imbalance. So with this, the problem is companies spend billions of dollars every year for a behavioral economics expert to design grocery stores, the lighting, the smells, the music, everything like that, in order for you to spend as much money as possible. And also a lot of the things that are hidden in our food, preservatives, things that lower the cost to produce them, that's usually very hidden. And so it can mean that we're not making informed choices. And so with this, I want to say an example. I was talking to somebody the other day and they were saying, great, I have a new iPhone. Isn't it wonderful? It's so cheap. And then I said, well, have you looked at some of the data sharing policies you agreed to when you purchased that iPhone? And her response was essentially, oh, I'm not that interesting. Of course, my counter, she happened to be an older woman, was that currently in Canada, baby boomers hold about 70% of the wealth. Of course, it's not evenly distributed, but in terms of generationally, they're the generation with the most amount of wealth. As well, women tend to be the primary household spenders. She was an older baby boomer woman. And so I said, you're not a target for this, you're the target for this. And so knowing that you are incredibly attractive to these large companies is important to understand. And then next would be demanding more transparency, trust, and explainability through policy. So for this, I want to use an example. Typically, this is an art exhibit, a pretty famous art exhibit called I Agree. And this is typically how products communicate their ethical implications. And it's very long-winded, agreement full of legal jargon, not really meant for the consumer, but mainly meant to protect the legal interests of the company. Most of us scroll through, scroll, agree, and we move on. However, the problem is this doesn't necessarily communicate in a very human way the nature of the threat. So when we look at implication design and embedding a product's ethical implication into its design, we look at an iPhone. I have an iPhone here. When it's being recorded, you'll see a little orange dot in the upper right corner. The problem is this is vague, it's subtle, highly ambiguous, and ultimately it doesn't communicate the nature or extent of the threat. So here we have this example. I went to go give Geneva a call before this session, and you see that little orange dot. It's highly subtle. Now, if we design products where their ethical implications were designed, I think things would look very differently. So there was a research example that essentially created an eye cam, which is a webcam shaped like a human eye that blinks, it moves, it looks around and observes you. If we had this, I think people would feel very differently about being recorded. Even in North America, Ring cameras are quite prevalent, and they're very subtle. They're not a human design, and they're kind of tucked away in places. And it gives us the kind of false understanding that we have ownership and control of what's on these Ring cameras, but that's not necessarily the case. If you were to replace these Ring cameras with a blinking eye that's watching people, I think we would see people would become much more uncomfortable with this notion. But in essence, that's exactly what it is. So with that, I open this up to the panel discussion. Hopefully that gave you some food for thought and some things to think about. I will stop sharing my screen right now. And there we go. So in terms of the panelists, hopefully you can still hear me okay. What are some of your thoughts on the societal implications of AI in terms of AI's potential threat to democracy, trust, greater inequalities, things like that? Stefan, maybe I'll kick it off with you.
Yes, for sure. Well, I think, first of all, I want to thank you for this great presentation, because what I think is so important and what you did so well is you showed us how AI is connected to our economy, our democracy, and things like healthcare and our data. And because so often today, I feel like AI is just a buzzword that is being thrown around and you don't really know what it is. So I think it's so important that researchers like you really look at what is AI and what are the risks and what are the opportunities. And the way that I look at it, and also what we, I think, see in what you have presented, is that AI has all of these risks and all of these opportunities, like all technology that has come around throughout the last decades, everything from the internet to everything from, if you think further back to the invention of the bicycle, you can use it for great things and you can use it for doing harm, unfortunately. And so I think one thing that I really loved about your presentation is that you showed us how we have to demand to use these technologies for good, and we have to demand this of our policymakers, and we have to talk about it, think about it critically to make sure we use the positive sides of it, and kind of mitigate, I think, the risks that lie within AI.
Agreed. Geneva?
Yeah, I would agree with what Stefan is saying about the importance of making sure that we're not completely denying the positive aspects of these technologies and the great improvements in terms of healthcare, in terms of access to healthcare, and productivity in general that can be generated from these AIs. But there are quite a few risks involved, and I think one of the most important aspects of this that you've highlighted is that of regulation. And I think one of the biggest risks has to do with the timelines, is that the technology is developing very quickly. That was true before the large language models became largely available, but even now more than ever, it's accelerating extremely quickly, and our legislation just isn't keeping up. So Canada is doing a good job. There is legislation that's currently under review regarding artificial intelligence and personal data privacy. However, it's just the timelines aren't aligned. So right now in Canada and the US, we have voluntary guidelines that corporations can follow. But like you said, those don't have any teeth, and there's not a lot of enforcement in a voluntary guideline. So I think making sure that we're pushing for legislation, but also that we're fast tracking this and making sure that it's a priority is very important. And then the other thing I would highlight is the importance of international cooperation, because any one country on its own, if they try to implement strong legislation for these corporations, that can disincentivize any kind of innovation in that country. And so they'll be at a huge disadvantage. It's important to make sure that countries are cooperating. I think the GDPR legislation that we see in the EU is an excellent example of cooperation within a large market, which means that companies can't just ignore that market entirely. They have to find a way to comply, and that can have knock-on effects for other people, even who aren't under the GDPR or who aren't within the EU, because if a company has to follow those regulations anyways, it's more likely that they're going to implement those policies broadly than necessarily just one small country making strides and then being completely left behind. So I think definitely making sure that we prioritize legislation and that we are cooperating internationally with other countries.
And just to build on that, you had mentioned fast tracking legislation because of the rapid pace of change. I think often we kind of see that we're trying to fit a round peg into a square hole. Like when we talk about government policy and legislation, it typically trails behind a lot of change and innovation that's going on. So do you see challenges, for instance, in this fast tracking of legislation, or are there opportunities, for instance, structural changes within policy to better support that?
It's very difficult because, of course, there's reasons that it takes so long to draft legislation, because you need to make sure that you're accounting for all sorts of unseen risks, that the language is correct, that it can be applied broadly and not just in one specific case. And I think it's difficult because it's hard to completely predict what types of capabilities will be possible and broadly accessible within the next few years, since there have been so many advancements in the field, even in the last year or two. So it's very difficult to predict every single case, but I think if you have a foundation of strong privacy protections and that you're broadly ensuring that there's some kind of compliance mechanism for corporations, I think that at least sets up a good foundation that you can always make changes and additions to later. But I think it can be a situation where perfect is the enemy of the good, where we're trying to make sure that we've perfectly aligned legislation to make sure that every single edge case has been accounted for, and that's simply not possible right now.
Yeah, exactly. Jay, do you have any kind of thoughts on this?
Yes, I do. And the question I had for the expert panelists here, let me preface this by saying I am not an expert in AI. I am an AI enthusiast. This is a tool that I have used for some of the work we do in nonprofits and some of the other work we do with some marketing advertising. But I'm not an expert in the subject, but I do have a question for the panelists, and very similar to what Brian Smith has put in the Q&A box.
Mhm.
It says, Brian asked, is there a reason why a country with high levels of equality wasn't included in your study, Leslie? I'd like to hear what you and the other think about that.
So the study did include countries with, for instance, middle equality. And so that would include something like Canada, where in general, we're pretty good. I mean, the last couple of years we've fallen off, I would say, even from the start of when I started this research project versus now, we see, maybe some of those rub points in society starting to show. But essentially, when we think about highly equal countries, we have, let's say, the Nordics, we have Japan, we have, significant outliers. And when we talk about generalizability of research, it's important that we take those lessons learned from those highly equal societies, but that results are applicable to a broad audience. And with something like AI and the scalable nature of AI, it, at its simplest form, will kind of exacerbate what's already going on in society. So if you have a highly fair and equal society, AI will likely make it more fair and democratic via increased transparency, increased accountability, greater access for these technologies. However, conversely, if you have a highly unfair, non-democratic society, AI will likely make it more fair and non-democratic. And we see essentially problems associated with that, even kind of cracks starting to show a little bit in terms of the North American model versus the European model, for instance. And so it is my recommendations and like suggestions for future study to focus on those high resource contexts. But when we look at the challenges for AI, or pretty well all health issues, you look at something like obesity. Well, what's the cause of obesity? It's poor diet, it's other systemic things. But there are causes of causes. So what's the cause for poor food quality, lack of movement, too much sugar in our food? Well, the causes of those causes are inequality, our consumer-based society in Canada, and things like of that nature. And so unless you're going to those root causes, the causes of causes, we're just creating policies that essentially are going downstream and kind of focusing on an individual level what you can do, but that's unlikely to change. And so suggestions for future study would be great. Let's look at the highly equal societies. But the reality is the average society isn't that equal. It struggles significantly. So what are we going to do about that in order to improve that? Because it will be a slightly different approach given that. Stefan, do you have any thoughts on that? I've been talking too much and then
No, I do have some thoughts on it, and I think actually that it's really inspiring to hear what you say, that AI kind of also means that we have to focus on, in general, improving our society, because an equal society or a society with more equality, a society with a stronger democracy will fare better in this, because AI kind of is just an amplifier of what is already there. And I think one danger of AI, and I come originally from a technology background, from an engineering background, and so I know how the internet was first created, even though I was barely born at that point. But the internet was really created as an open source thing. So it was created as a university research project to share knowledge. And only much later in that process was it then commercialized, and the internet as we know it today came to be. So the roots of the internet are really kind of in a shared good, kind of, in a way. Whereas with AI, we can see that almost from the beginning, it was highly commercialized. It's used by huge corporations. It is mainly built by huge corporations, very different from the beginning of the internet, for example. And so I think this means that we have to be even more diligent in making sure that it is used for good, because there are pretty big motives behind there to use it for profit, to use it for efficiency gains, which can be great if it profits all of us. It can be great if it improves our society as a whole, but it can be problematic, as you said, if we have a very unequal society because it will make, unfortunately, if it's used the wrong way, it will make those who are unfortunate into an even worse position. And so I think it's really important to kind of try to build a strong and good society and democracy.
And two problems with that I'll talk about is one, the scalability of it. Before, if we had a company that wasn't great, that was exploitive, like Canada, we have a beaver pelt company hundreds of years ago. It was, bad that they're, overproducing these pelts. They're hurting ecosystems, but that's still a quote unquote relatively small impact. Now that we're dealing with we have so many companies that are just so tremendously large that they're really growing separate from their roots in individual countries. And I mean, as we move towards further digitization, physical space matters less and less. And so we need to kind of start to look at companies as if they are countries, because from an economic standpoint, they effectively are. And they're arguably some of the largest, most effectively run economies in the world. And then the next would be the concealability with AI. Before, I think it was never easy to spot potential exploitation or potential power imbalances. But now things are so tucked away and hidden in an AI system or with a Ring camera or something like that, that most of the time, the perfect crime is the person doesn't even know they've been robbed. And I think we're kind of starting to see that a little bit, where the average person couldn't pinpoint a moment in which, hey, I was violated here. And so those two factors mean that we very much have to approach politics and international politics very differently than we have in the past. Okay, so then my next kind of question is, what can individuals do to protect themselves and empower their families? I know this is a very difficult conversation, but when we look at it on a family level or a child level, what do we do to kind of help folks in that way? Jay, you have kids. Do you want to, add a few words to this?
I mean, some of the practical solutions that we've come up with as a family. We know that there's lots of scams out there, even phone call voice scams. Like, I mean, my voice being on YouTube now with this call, someone could use my voice, call my mom, and ask for money to bail me out of jail. So we've got a family safe word that if it is a true emergency, I'm going to drop the safe word. Then mom knows this is actually Jay, and he has a real problem.
My family has the same, and I said to my parents, you know what, if someone calls and says that I'm in jail, I probably deserve it. So just like let it ride.
Yeah. So I mean, there's some small practical things that you can do, but if those are all conversations that you really can't have over email or text message, those are in-person conversations. And so I encourage everyone to have those conversations with your family.
Exactly. And even just, the shift of being online and being in the real world, I think getting information from the YouTubes, Facebook, everything like that can be very highly problematic. Have conversations with people, turn off the phone, turn off the computer, read books, it's not perfect, but you're definitely getting it through a different lens when you're doing it more of that physical in-person approach, as opposed to receiving so much of your information, entertainment, financial management, everything like that from digital sources. Stefan?
So for me, I think there's two thoughts that come to mind for me. The first one is, I think those conversations that Jay was talking about, I think we should get used to having those as a regular thing from time to time. Talk about, okay, what is happening in technology? What are the risks? What are the possibilities? Just like we talk about so many other things that are happening. What is the new good movie in the cinema? What is the new good music? We should also be talking about, okay, what's happening in technology? Because to be honest, the biggest problems, we don't know about them yet. The biggest scams, the biggest risks, they will be big risks because they will be new. They will be something that we haven't seen before. And so it's important that we kind of get into the habit of talking about these things. And I think that of course it's kind of challenging probably for you right now as an AI researcher, because things are changing so fast. And I know that your research deals with artificial narrow intelligence, which is more like the things that are invisible now and are happening in the background. And now everyone, when they think of AI, they of course think of ChatGPT and large language models, which is something slightly different. But I think any kind of opportunity like we are talking today to talk about these things is so important and relevant, and will in the long term protect us because we have more knowledge and we are more comfortable with these changes and these new technologies.
Geneva?
Yeah, I agree with everything that Jay and Stefan said. I think it's difficult on an individual level. So you can have a certain amount of control over what information you decide to put out there, which types of apps you download, etc. But it can be difficult when other people around you are also sharing that data. So for example, I could choose whether or not I would want to participate in something like Ancestry.com or a 23andMe, where you're giving up a huge amount of personal information that could be used in different ways in the future. We've seen some changes in terms of how that data is being used or how it's being protected. But if my brother or another family member decided to use it, they would still have a lot of information about me. So I think what Jay mentioned about having conversations with the people around you and coming to some agreements if you're able to is important. But I think also what you mentioned, Leslie, about on the personal side of things is being really aware of how you're digesting and where you're consuming information from. So right now, if you're primarily using social media, there's a lot of bad actors who are intentionally manipulating public views, political conversations. There's a lot of bots that aren't necessary, that are indistinguishable from other people. And so I think being very careful about and intentional about where you're getting information and using trusted sources is probably is very important, and is especially important for young people because they haven't necessarily developed the skills to differentiate information. So with ChatGPT, it's difficult because it's an extremely useful tool. And for lots of subjects, it's an amazing learning resource and it's great for education. But on the other hand, it can also just create false information, right? That's one of the risks of it. And if you're an adult who's been, educated in critical thinking, you might be able to figure out that something's not true. But for younger people who haven't necessarily developed those skills and are online more than anyone, I think you have to be very careful about where they're getting their information from, especially since they might lean more into non-traditional sources like YouTubers, TikTokers, etc.
Exactly. And I think something you said was really important, that it's very difficult to manage this on an individual level. And so there was a question in the chat that essentially says, how do we mitigate political ideologies that prevent timely regulation? And I think with this, with AI, with society, or climate change, or much of some of these larger issues, we have to recognize that it is bigger than us on an individual level, and so we need to, for instance, demand greater. We need to hold politicians more accountable, and also switch different political systems. And I'd be interested to hear your thoughts about this. But I was recently reading about kind of a shift in prioritization of politics, of what the new ideal leader is. And because of the fixed resource model on the planet and increased globalization, before politicians were, selected based on their leadership and, their ability to kind of defend national competitiveness. Whereas now we're seeing a shift in terms of more collaborative leaders who are able to think more, who have stronger critical thinking skills, who are more cooperative with other folks. And so I'd be interested to hear your guys' thoughts in terms of how to switch that. I know we don't have a ton of time, but it's just would be neat. Geneva?
So sorry, can you just summarize the question in terms of what we're looking for in our political leaders, or?
Yeah, exactly. Well, the question specifically was related to how do we, I can't see it in the chat now, answered, sorry. How do we mitigate political ideologies that prevent timely regulation?
That's a tricky one. I think if anyone had the answer for that, we'd be a lot further ahead. But I think the main thing is ensuring that we're not getting caught up in small minutia that you know is that we're not getting caught up in edge cases related to a specific ideology, and that we're instead looking at kind of the bigger picture about how having some type of regulation can benefit everyone, regardless of where they fall on the political spectrum, and how that can help strengthen our democracy, which is important for making sure that everyone's views are being heard, so that we're not necessarily giving preferential treatment to any particular side or ideology. But it is extremely difficult because there's a lot of different bad actors, there's a lot of misinformation happening right now, and there's a large divide politically. So I think finding ways that we can collaborate and work together is really important.
I mean, I hate how quickly these sessions go because, Stefan, I feel like you have such an interesting perspective on this, coming from like an EU perspective, that I feel like even just that we could talk about for forever. Like, do you have any closing words related to that? I know Jay's going to be breathing, being like, no, stop asking people questions.
And I can try to make this really quick, okay? So sometimes I think we feel like politics is going so slow, but in reality, most politicians are very quick to jump on things if the general public demands it. If they can see, oh, I can gain some votes from this, this is a topic that is important. One example, okay, here in the EU, and we all know it's very hard to put in legislation to protect data. But here in the EU, it's not perfect, right? But you can message any company and say, tell me all the data you have about me. And they have to do it. And you have the right to do that. You can message any company and tell them, delete all the data you have on me. And you have the right to do that. That is just written and part of our data protection laws here in the EU. Why? Because as a society, people here in Europe, especially in Germany, Austria as well, they value their own privacy and their own data. Other countries, the value for privacy and data is not so high, and so you don't have these laws there. So if we want change, or if we want better protections, then we have to loudly demand it. And politics will follow. And I know it's very hard to regulate AI, but we are smart enough to build AI, which means we are also smart enough to regulate AI. And there have to be smart laws that look into the future, that think about possibilities, but they will only get created if we, as a society, say this is important to us and we want this to be done well. And then immediately there will be target groups and politicians will understand this is how I get voters, and they will jump on this. So these are my thoughts, and we see that it works by the different policies and in different countries.
Exactly. And just as a closing, I think it's easy for countries to become more isolated and become more introspective. But there are many countries in the world who are approaching things in a pretty proactive, pretty reasonable way. And because of the shared global challenges, none of us really have to reinvent the wheel. And there's tremendous opportunities for this kind of international collaboration for us to adopt things that are already being implemented in other countries, as opposed from starting it from scratch. But I know we're pushing up on time, and so Jay.
Yeah, we do have to reel it in. I mean, this is the second lecture we've done on artificial intelligence, and I mean, we could do a third and a fourth, I'm sure. This is a topic of great interest, and I'm sorry we didn't get to all the questions in the chat. So as we conclude this lecture, first I'll point out my background. I hope it's the right orientation for you guys. It's backwards for me, and get to reverse the mirrored camera. But there's a mental health first aid course that Gateway is offering with in collaboration with some local partners. If mental health first aid is something that interests you, how to deal with a mental health crisis, whether for yourself or for in the workplace, family, friends, this is the course for you. Space is limited and registrations have to happen by Thursday, the 5th. So please scan that QR code and register. As we conclude this lecture, we hope that this has proved to be informative on the theoretical and practical implications of artificial intelligence and what it might mean for rural health. So thank you to our expert panelists, Geneva, Stefan, and our keynote speaker, Leslie. I think it's been very informative today. We'd also like to thank our sponsors for their continued support, because without them, this lecture series will not be possible. These sponsors include Microwage Basics, McGee Motors in Goderich, Libro Credit Union, Lighthouse Money Management, McEwen and Fagan Insurance Brokers, Huron Telecommunications Cooperative, Zayers in Goderich, CIBC Wealth Management, and the Goderich Royal Canadian Legion Branch 109. So Gateway is a nonprofit organization with charitable status, and we greatly appreciate any support we receive. If you yourself would like to make a donation, you can head over to gatewayruralhealth.ca/donate, and you can also follow us on Instagram, LinkedIn, and X, and Facebook. So our next lecture, Tuesday, April 2nd, where we will learn about the hospital-to-home transitional care with older people in rural communities with expert Dr. Mary Fox from York University. So until then, thank you for attending. Thank you again to our panelists, and we'll see you next time.